There is a tremendous opportunity for hospital pharmacists to bridge between inpatient care and outpatient care. When you hear people talking about accountable care, again, typically what that means to me is it's a much broader continuum of care. So I think there's been a great deal of emphasis on how are we going to manage patients as they transition from one area of care to the other.
Key business areas today for hospital pharmacy is really this ambulatory pharmacy. It can help reduce costs from an improved patient care perspective and continuum of care perspective, as well as it can help increase revenue.
For Stage 2 meaningful use, pharmacy plays a key role in that bedside barcode administration is a primary focus. And for that to be accomplished, all the drugs need to be barcoded.
About 15 to 20% of medications, the oral solids that a hospital uses, are not available ready to use in barcoded format. There are basically two general philosophies that I'm seeing as I travel around the country. The first is to repackage those products in-house. The other camp is to try to move that repackaging out of the pharmacy and minimize the amount of internal, being that there are other things that the pharmacy would like to focus on. By influencing what goes into a decision support system, the pharmacist can be guaranteed that they basically have a hand on every medication order 24 hours a day, 7 days a week. I'm going to see more technology implemented over the course of the next 5 years than I've seen in my entire career prior. So it's a very exciting time.
The pharmacy department can have a huge impact in preventing hospital readmissions by proactively educating patients on the proper use of their medications and the importance of those medications. And by having a program in place to facilitate that and to follow up with patients, the results have been tremendous.
So one of the things that we know is if a patient takes more than 5 or more medications that they're prescribed at the point of discharge, those patients are at extremely high risk for some type of event if they don't have specialized training at the point of discharge and or ongoing follow-up. And a hospital-based ambulatory pharmacy is the perfect environment to provide that type of support to those patients, because obviously there's a heavy motivation there. Not only do we want to see that the patient gets the ultimate outcome, but that ultimate outcome would be keeping them out of the emergency room or not having them come back for a readmission.
I believe as hospital CEOs today are looking out into calendar year 12 and 13, it's first and foremost, how do we keep our doors open? With the cost pressures that they face every day, coupled with healthcare reform that's coming and increased regulations, it becomes more and more of a challenge for them to meet the lower reimbursements that they're receiving, taking care of an indigent population, and looking for ways to increase revenue. Hospital pharmacies today can play a major role in helping their CEOs and the C-suite meet these challenges today. Indigent care today is probably at an all-time high, and hospitals are looking for ways to be able to bring some of that revenue back into the system that they've lost by treating these patients. McKesson has put together a very robust program that we call MedSource, and MedSource is a program that goes out and on the hospital's behalf looks for indigent patients that they're treating and then matches that up with the drugs that may have received to get the reimbursement back from the manufacturers that offer programs today.